So let's talk about upper eyelid blepharoplasty, sort of the evaluation for it. Um, Upper eyelid blepharoplasty, or the extra skin removal from the upper eyelid, it's really a preservation surgery. I'm not trying to remove as much skin as possible. I'm definitely not trying to move as much fat as possible. If you're hollow ahead of time, I will note that, and we might even put more fat in. Oftentimes, the inner corner fat pad does get removed, and skin gets removed. I mark you on the morning of surgery upright. So you're sitting up. So gravitationally, I can see what that does to your face, and I can mark exactly what the overhang is. That's how I can get the most natural looking result. I'm not just pinching as much as possible, rather I'm seeing where the overhang is sitting, and that's what sets this office apart in that preoperative time period. Um, Skin and sometimes muscle removed, it's really customized to what you'd need. And what your face would look best with. Sutures are closed, and then I remove that a week later, and you have antibiotic ointment for the just to cover the suture line. That scar, let's call it, will go through 3 phases. So the first month it'll be red and ropey. Ropey is because it's thick and elevated, and that's normal. The second month it'll be pink and flat, and by the third month we should barely see any of it. And that's usually what the course of events are. I like to put that incision right into your natural crease so it just gets buried in perfectly. And if you do have a lot of overhang on the outside, I like to bury that into a crow's foot or a wrinkle if you have that available for me. Now, of note, um, the brow has a big interplay with the upper eyelid. So some people might need a brow lift, because if I lift my brows up, you can see that there's some elevation of the skin as well. So therefore less skin would need to be involved. So that evaluation is also part of the upper eyelid blepharoplasty evaluation. So I'd like to talk about the preoperative, the morning of experience for an upper eyelid blepharoplasty. So the upper eyelid blepharoplasty is really a marking and intensive interaction. So I take the marking pen, and I like you to please not use any moisturizer on your upper eyelids because it won't stick. And I would mark, with you sitting upright, the upper eyelid region. I usually like to start with you laying down so that I can mark the crease, and then I have you sitting up to see what the overhang is. So it can be really precise and customized to you. Oftentimes, if it's only an isolated upper eyelid blepharoplasty, I can do this under straight local. So you're numb and don't feel anything, but you're wide awake. We can give you a little anti-anxiety pill to take the edge off, or you can elect to have anesthesia for it. Sort of the options are pretty open there. A lot of my patients like to do it under local, because it's not painful, and then they can just get up and go and not have to deal with any of the um, anesthesia effects. But some patients say, look, I don't really want to know anything's going on. Do your thing. And that option is obviously available because we have that accredited operating room on site. Um, afterwards, Immediately afterwards, we start icing you in the office. And then I'd like you to have the cool compresses available at home, whether that be a cool pack that you buy from the pharmacy that's in the freezer, those gel packs, whether that's frozen peas in a Ziploc bag that's been pre-prepared, or actual ice, however you like to do it, as long as it's a cool compress every hour while awake for the first 3 days for 15 minutes at a clip, and then 5 times a day after that until you see me at the 1 week mark. So aftercare with the office. So obviously we're in touch with you during the first week. You come back a week later, I remove your sutures, and probably have you continue using the antibiotic ointment for a few days after that, but that's about it. At that point, the icing is less important, but if it feels good, you can still ice it. I still, at that point, I'd have you not use contact lenses until that point, so then you can return to your contact lenses if that's what you're using. You can resume exercise 2 weeks after the 1 week mark. So that's 3 weeks after surgery, so that I know that we're in the clear. But again, you can go out walking as long as you're covered from and protected from the sun after that. You can cover the bruises with, if you still have bruises a week later. Many patients don't, but if you do, you can cover them up with makeup, or cover up at that point in time. Everything's fine to do from that perspective. Most of the time, patients have some swelling, though, right above the eyelash region, and that just needs a little more time to go away. And other patients look great after the week. Thanks.